Hello, everyone, and welcome to today's webinar, Masters in Public Health Preparing for the Next Steps series, Part 1, Advocacy. My name is Rhiannon Bednar, and I'm the project coordinator at the Region 5 Public Health Training Center. The Region 5 Public Health Training Center is part of the National Public Health Learning Network, a consortium of 10 regional public health training centers and the country's most comprehensive resource for public health workforce development. We seek to strengthen the skills of the current and future public health workforce through learning tools, continuing education, and student development. We encourage you to check out our other training offerings on our catalog at rvphtc.org. This webinar is brought to you in partnership with the Ohio Public Health Association. This 4-part series will help prepare Ohio MPH students to enter the ever-changing field of public health. This first session will focus on strategies for effective public health advocacy. Next slide, please. We have a few housekeeping items to go over before we get started. All participants are in a listen-only mode. If you would like live transcription for today's webinar, you may do so by going to the Zoom menu bar and selecting live transcript. As a tip, if you don't see it, try resizing your screen so that it's wider and it should appear. Then click Enable Auto Transcription. This button will turn blue, indicating that live transcription has begun. Please add your questions into the chat box. We will not be using the raise hand or Q&A functions in this webinar. Depending on the question, we may type an answer back to you or save it for the designated Q&A segments. And we will do our best to get to as many questions as we can. The slides were included in the reminder email sent out this morning. They're also available for download from the Canvas course site, and I will put that in the chat shortly. And today's webinar is being recorded, and we'll send out a notification when it's ready in the coming weeks. Lastly, there are no continuing education credits for today's webinar, but there is a certificate of completion available as long as you meet the attendance and evaluation requirements. The evaluation opens at the end of this session. Next slide, please. And so while today you'll learn about advocacy and lobbying and how they overlap, they are different, and we would like to note that the Region 5 Public Health Training Center cannot and does not in any way encourage you to lobby for or against this or any piece of legislation or candidate. The bills or initiatives that will be presented today are from past examples, and we are not asking you to lobby. Next slide. And I would like to take a quick opportunity to acknowledge my team who is integral to the planning of today's webinar. Donnie Zemmel, our Training and Engagement Manager, who is also here with us today, and Phoebe Kulik, our Senior Director of Workforce Development. Next slide. And now I'm happy to welcome our moderator, David Mayware, who is a consultant for the Ohio Public Health Association. David is the former executive director for OPHA and has over 50 years of experience in the nonprofit arena, managing complex local and statewide social service agencies and policy advocacy organizations. So now I will pass it over to David to introduce our speakers and get things started.
Thanks, Ron. I'm really glad to be here today and really glad to be moderating this particular group of people who I've had a chance to work with over the years. But first, I want to tell you just a little bit about OPHA. Our mission is to be the inclusive voice for public health, to proactively advocate for policies that reduce health disparities and empower all people to achieve their optimal health and to advance the practice of public health in Ohio. Today, we're grateful for the financial support which comes from Ohio Department of Health and the 400+ members of the Ohio Public Health Association. And of course, we're also grateful to the Region 5 Public Health Training Center, Donnie Zemmel, Rhiannon Bednar, and Phoebe Kulik for their support and capacity to make these webinars a success. This webinar is part 1 of a 4-part series built on the wants and needs of MPH students in one of 9 education institutions in Ohio. We listen to your voices through our survey and will present webinars on public health career resources, communications, and take a look into the day in the life of public health professionals. Our presenters today will describe safe and effective techniques to influence public health policy. Presenters will discuss how change can be implemented at the legislative versus the administrative arenas, and participants will also learn about the difference between providing education to policymakers and lobbying. Today, we're fortunate to be joined by a panel of seasoned veterans of the legislative and administrative process. First, we have Aaron Ackerman, president of Ackerman Consulting. Aaron started his career in government, interning in the leadership office of Congressman John Boehner. Later that year, he was accepted to the prestigious Legislative Service Commission Fellowship, where he began his work at the Ohio State House, staffing the offices of State Senators Louis Blessing, Scott Nine, Bob Latta. Since 2000, he's been an independent lobbyist, currently providing support and guidance to the Association of Ohio Public Health Commissioners. Next, we'll hear from Dustin Holfinger, the Government Relations Director, American Heart Association. Dustin began his career in policy and government during the summer of his junior year in college when he interned in Congressman Dave Hobson's Springfield District Office. After graduation in 2003, Dustin was hired as a legislative aide for the then Representative Chris Widener, also from Springfield. Since 2006, he has worked for a wide-ranging group of both nonprofit and private sector groups. He joined American Heart Association in 2019, advocating on behalf of public health issues. And finally, we're joined today by Angela Snyder, coordinator of the Ohio Immunization Advocacy Network and senior account executive with Lysick and Camper Communications. Angela is a senior account executive with Lysick and Camper Communications with extensive experience in public affairs, healthcare, statewide political campaigns, media relations, and knowledge of state and federal government. She leads a wide variety of engagement efforts with members of Ohio's General Assembly and congressional delegation regarding access to medication and senior citizens issues. Angela manages a wide variety of statewide coalitions that focus on vaccine advocacy and medication access. We're going to give you a little bit of an idea of what the objectives are. Have the objective slide, that would be great. So the objectives today are to describe the steps in the process to impact policy change, to recognize the differences between lobbying and advocacy, and to discuss the ways to engage the community in advocacy and the work of policy change. And I know no three better people to do that than the three that you're going to hear from today. So I'm really happy to have made the call to all three of them and to have had them answer, especially in these busy times. I can't imagine where you're all going to go after you get done with this. But first, let's turn the floor over to Aaron. Good morning, Aaron.
Good morning. Thank you, David. Appreciate the introduction, and thanks to all the students that are on the call. Really appreciate your interest in the topic, and certainly I think it's going to be important for us to go through. It's going to be important for you for the rest of your careers as you enter into public health. I was actually at a meeting with my client who is basically all the health boards around the state, the health commissioners around the state, and we were kind of going through some advocacy planning and strategy. And one of the things that kind of kept coming up was people were saying, I just didn't realize what a big part of my job, advocacy and lobbying, was going to be when I signed up to be a health commissioner. One person even remarked, I just wish I would have known all this stuff when I was in school. So right on the heels of that, we're doing this webinar, which I think is pretty cool. If we could go to the next slide. So the goals for my part of the presentation really are to talk about what advocacy is, why it's important, and then what you can do at this stage in your career and as you move out and start being employed in the world of public health. So real quickly, I'd like to start this off by maybe asking you, what does advocacy mean for you? And what does that word mean for you? When someone says they want to advocate on something, what does that mean? And you go ahead and type in the chat, and we'll give you a couple minutes to think about that. I see one person that says advocate means support, justice. Law, giving voice to community. Influencing, representation. These are good. Going to bat for someone. I like that one. Lending your voice. Awesome. Recommendation, public support. Good. Good. Well, those are all, I think, different components of what we're going to talk about today. And I'm glad to see that many of you already have a real good conceptual understanding of what it means to advocate. If we go to the next slide, we'll kind of get into the meat of the presentation. In my experience, advocacy is multifaceted. Obviously, it involves direct lobbying and lending your voice to a certain cause and trying to influence the outcome of a public policy debate. And I think traditionally that's what most people think of when they think of advocacy. But in fact, like I said, it's multifaceted. And a large part of it is really simply education. A large part of it is listening to policymakers and understanding what their concerns are so that you can help them craft, and ultimately pass good public policy as it relates to public health. So I'm glad to see that many of you in your comments picked up on various aspects of what advocacy is. If we go to the next slide. So we'll talk about all three of these concepts. Education, what does that mean? Well, really, public policymakers, state legislators, people who are in the governor's cabinet and at various state agencies, they come to the table with different backgrounds and experiences. And candidly, a lot of them don't have a clue as to what public health is. So before you can even get around to asking for a very specific action on a very specific bill, like Dustin's going to run you through an example of a very specific effort that he was involved in, you really need to make sure that that legislator or that individual that is making public policy decisions understands what public health does. So you start off very high level. What is public health? What do we do day in and day out? And I put in there, is it only masks and vaccines? There's a whole crop of legislators that have only seen public health through the lens of the pandemic and may not understand that, yeah, that was a big deal for public health, but that's what we do, 2 out of 100 years, 3 out of 100 years. The rest of the time, we're doing a lot of other important functions that are out and about in the community, and we just need to make sure that that legislators kind of have that holistic view of public health. We need to educate them as to who our stakeholders are. I think it's really important, and the strength of public health is that we serve really to coordinate and collaborate a lot of different organizations, very similar to what OPAHA does. We deal with county sheriffs, we deal with county commissioners, we deal with other groups like the American Heart Association. We have all kinds of partners in public health and all kinds of stakeholders. And I think it's important for legislators in particular to understand the breadth of exactly what it is that we do and who we work with in their community. And then how do we serve the public? What do we do day in and day out? And consequently, that obviously would impact that policymaker's constituents. Next slide, please. So what about direct lobbying? Once you've educated a policymaker, what does it mean then to actually go and lobby them? Well, there's different components even within lobbying. There are lots of various techniques that you can use. One-on-one meetings, which we'll talk about a little bit later, certainly are part of that. Meeting with your legislator, telling them who you are, what you do within public health, and then asking them directly to help you out. Pass this bill, don't pass that bill. Consider changing a piece of legislation to do something different than what it does now. Pass this rule or whatever the case may be. That's direct lobbying, and that involves meeting with people and talking to them face to face. It also means that you can engage in grassroots campaigns. And again, Dustin and Angela are going to give you a lot more details about this, but at a high level, that just means that you are generating letters from constituents, phone calls, emails. A lot of what I do is just basically educating my client, the health commissioners, about what's going on at the State House, and then letting them know when there are opportunities to pick up the phone and call their state legislator and advocate one way or another. And then grass tops, and this is just really kind of a fancy way of saying that all those partners that we have, whether they're county commissioners or mayors or township trustees, these people that are kind of leaders within their own communities, they can be mobilized too. We have the ability, because we have a lot of mayors or city council people that serve on boards of health. We can pick up the phone and call them and ask them to reach out to their policymaker, to their legislator. And they probably have a pretty special and unique relationship with that member, because they are elected in some rights, in some ways within their community. So they have that kind of elected official to elected official experience, and they can be very helpful. Next slide, please. Listening. I kind of think listening is a two-part thing, where part of it is research on your part and kind of understanding who your audience is, and the next piece is actually trying to kind of understand what their issues are. So before I take any client in to see a legislator, I really ask them to know who they're going to be talking to. That includes what political party are they from? What's their worldview? In other words, just because you say you're a Republican doesn't mean you necessarily agree with everything that the Republican Party stands for, and vice versa with the Democrats. So there's a lot of nuances and subtleties to legislators, and understanding kind of how they view the world is going to greatly impact how they view public health. Have they interacted with public health in previous capacities? Were they a county commissioner or a township trustee? Have they served on a district advisory council or on a board of health? Are they a restaurant owner? And so maybe they've had restaurant inspections, or they own a grocery store, and so they've had produce inspections, or whatever the case may be. You want to know these things about the legislators that you're going to be meeting with and talking to as you're advocating with them. How long have they been in office? What committees do they serve on? These are all things that are pretty much available publicly, that you certainly want to try to understand before you even pick up the phone and call your state representative or state senator. Next slide, please. It's also good to kind of know, what are their general views on public health? How did the pandemic inform their view? There are some people when we go to the State House who understand that public health was, very important in helping to wrap up the pandemic. They understand that what we were doing to protect the public during this crisis. Other people candidly view us as the enemy. And they view us as the people that came in and made people wear masks and get vaccines and shut restaurants down. And so knowing, their perception of this very important event in the past 2 or 3 years really is critical for you. It's going to inform how you have your conversation with them. How do they view the role of public health in their communities? Are you helping? Are you hurting? There are legislators that feel very strongly both ways. And do they, and how do they believe that public health can benefit their communities? Again, by talking to folks, you can kind of discern and begin to understand a lot of these nuanced positions that are really going to help you understand how to speak to an elected official about public health. Next slide, please. Why is this important? Well, health districts are created by statute. So in the state of Ohio, Title 37 is the law that pretty much governs how public health operates in the state. Certainly for county and combined health districts, we really can't do anything that the state legislature doesn't tell us we can do. City health districts have a little more flexibility because of home rule, but it's the law matters to health boards and health districts because we are governed and constrained by what the legislature, through the enactment of laws, tells us we can do. Because of term limits, democracy is a lot more accessible to the public than it used to be. Legislators have less time to be here and accrue power, so more lawmakers contribute to the policymaking process. Your legislator, whether they're in their first term or their fourth term, or if they've gone from the House to the Senate and are have been here for 10 or 12 years, it doesn't matter as much anymore as it used to. They're going to have the ability to have influence and have a say in how laws are enacted. And it used to be before term limits that power really accrued because people were here for a long time, and so we had a speaker that served 22 years as Speaker of the House. Now contrast that with the legislator who, under term limits, can only be here for 8 years in any given position, and you kind of understand that after 22 years, that speaker had a lot of power concentrated around him. And so if you happen to know the speaker, great. If you didn't happen to know the speaker, you may not have had as much influence. I think term limits have kind of changed that and turned all that upside down. Next slide, please. So what can you do? Well, being here is a great first step. Learning about government, the legislative process, issues impacting public health is really step one, to educate yourself about what's going on in the world of public health and how policy making is shaping and influencing that. And associations are a great way to do this. OPHA is very active on the advocacy front. The American Heart Association is very active. Angela represents many associations that are very active in advocacy. And so plugging into those associations is really a great way as you start your career, get active in your association wherever you end up. Meet your legislator, as we talked about, by scheduling a time to see them and go through all those steps that we talked about to make sure you kind of know who they are and what their worldview is and how they feel about public health. And then really work to establish yourself as a trusted source of information for that legislator, for that policymaker. And remember, this requires effort. It's not a matter of just calling them once a year and thinking that's going to be a relationship that's going to be productive or fruitful. It really does require a partnership. It requires you to give and take and to listen to them and understand their views and what their thoughts about public health are, as well as sharing your views about what public health is and what you're doing to serve their communities. Always be truthful, direct. Try to make sure your legislator hears about public health issues from you first. Whether that's good news or bad news, you want to be the person that's calling your state representative, state senator, and saying, here's what's happening in my health district. Here's what's happening in your community, and give them the opportunity to ask questions. You want them to pick up the phone when they hear that there's been a train derailment and call their health commissioner, and be able to get the skinny directly from the source. That's all part of advocacy. Next slide, please. So my conclusion, it's really not an option to just stick your head in the sand and pretend that nothing's going to happen to you as someone who's involved in public health. Legislators, they're in Columbus, they're in DC to legislate, to make laws. So they are going to do that. The question is, are they going to make informed decisions? Are they going to make informed laws about public health that you have weighed in about, that your colleagues and peers have weighed in on, or are they just going to make them in a vacuum with no input from local public health at all? So I might leave you with that thought to chew on, and really emphasize that, legislators are going to make laws. It's up to us to make sure that they make good informed decisions and that they're hearing from local public health. So with that, I'll wrap up my portion and turn it back over to David.
Great, Aaron, thanks so much. And Aaron will be with us throughout the presentation this morning. And so if there are questions that you have for him, you can ask them in a while or right now. And next up is Dustin Holfinger with American Heart Association. Dustin.
All right, thank you, David, and thank you, everybody, for, again, as Aaron said, thanks for having us today. We really appreciate it. And the comments that Aaron made about making your voice heard couldn't be better. It's really the true way to make good policy across the state of Ohio, and to get those messages into legislators is essential for them to make those informed decisions. Next slide. So as the government relations director for the American Heart Association, we work at all levels here at the AHA. We work at the local level, passing policies regarding with schools and their tobacco-free policies. We work at local level on CPR training and requiring those for the city councilors, as well as your local first responders, working with our schools, getting them out there. At the state level, passing different policies ranging from self-monitored blood pressure and ensuring that those are covered through Medicaid. We also work on tobacco retail licensure at the local level, and among many, many other issues dealing with public health issues. But I want to talk about one specific issue that we worked on for many, many months, and then kind of the timeline as to how that played out in the final days of 2022. So we reached out to the Columbus City Council, actually pre-pandemic. I remember meeting with them. We didn't know what was going on. There was no masks anywhere. We didn't know it was a respiratory. We thought it was on surfaces, so we had to clean everything off, and then everything shut down. But we met with them about the potential to enact a policy that would restrict the sale of flavored tobacco products. And this would include menthol cigarettes, as well as the flavored vape products that we're seeing our schools being inundated with right now by youth usage. So a few months kind of went by, obviously, with everything kind of going on with the pandemic, and we kind of shelved that idea. They had other priorities, as Aaron mentioned, with working with the local health departments. And then we come back into the legislature, come back to the city council with a policy in hand stating this is what we want to try to do, not only to restrict the sale of flavored tobacco products, but ensure that those tobacco retailers are held accountable through a tobacco retail license, and tightening that up to ensure they're not making sales to underage students. So Columbus City Council, after months and months, and I mean that, that's not an exaggeration, there were probably 12 public hearings that included Public Health Association members and volunteers like myself and staff, There were also public hearings with the small business community, those actual retailers. They wanted to get their voice. So that's the other thing. There's always another side of the story. And you have to remember that if you're not telling your story, someone else is telling it for you. So keep that in mind as you're telling your meeting with your legislators and talking to them about these specific issues. But they did hear testimony from both sides, constant back and forth on language changes. And then ultimately on December 12th, they passed a restriction on the sale of flavored tobacco products for the entire city of Columbus, city proper. We called on volunteers through that entire process to reach out to their legislators. That's our You're the Cure network. These are all members from the state, all across the state of Ohio, calling on them to email their legislators to support this proposal, to include menthol cigarettes, to include all the vape products, to make sure it's a comprehensive approach. We had multiple AHA witnesses and volunteers testify on the dangers of these products to City Council and discuss that with them. We brought in officials, experts on these topics to discuss it at various times and various lengths and at various depths as well. We really dived in at one point to, what are these flavors and why are kids attracted to them and what are they doing about it? So that screenshot right there is just an example of one of the alerts that we sent out to our You're the Cure network, asking them you can see Council Member Elizabeth Brown was the first one that comes up, and that email went out to every single legislator. And we make it editable as well, so you can add your own flair or your own personal story to your letter going to your legislator. Again, informing them or advocating on behalf of this issue. Next slide, please. Literally the next day, this bill passed on December 12th, which was a Monday at 5:45, 6 o'clock p.m. Watching it on my computer. The next day, we heard rumblings that the state legislature was looking to preempt this policy. And preemption, for those of you that are unaware, is the state level or a higher level of government basically explicitly telling a local government or a lower level of government that they cannot pass a policy on this particular issue. That's exactly what we saw. And we expected this amendment to be very narrow in scope and really only preempt the ban the ban, essentially, is what we expected that legislation to read. As we got our hands on a copy of that legislation, which, mind you, we spent 12 hours that day in the Senate Ways and Means Committee waiting for this legislation to come around after delays and everything else going along with that, drafting testimony in that process of waiting, we received a copy of the language. For all intents and purposes, it went nuclear. Not only did they ban the ban, but this legislation, this amendment would have preempted any local tobacco or any local political subdivision from passing any tobacco control policy. That not only included the tobacco retail licensure work that the state of Ohio has been working on, we've been working on with our coalition for the last 10 years. And by the way, our coalition was called the Coalition to End Tobacco Targeting for many reasons, but specifically the targeting of the African-American community and menthol cigarette manufacturers, as well as the vaping products that are targeting our youth in the state of Ohio. So we had a coalition of probably 10 groups. I'd say that might even be exaggeration. It might have been 8 that were working all together with the Columbus City Hall to ensure that this policy would go through. Excuse me. And then as that legislation passed, again, the legislature decided to preempt this legislation with an amendment that was 4 pages long on a bill that was innocuous initially. It dealt with bad debts for tobacco retailers that went out of business for them to be able to recover their debts. Really didn't take a position on that. So there was no opposition to House Bill 513, this legislation, until this amendment came out. And again, this legislation would have preempted every political subdivision from passing tobacco control policies from the city level on down to the school district level and our parks. If a political subdivision had passed any policy that went farther than what the state Ohio Revised Code stated, which school districts have we at the state level, we have a indoor smoke-free policy, but that does not cover the football stadium or the parking lot or anything else outside of the building. Many schools, I would say almost all probably, have enacted those types of smoke-free policies, including our park districts. Who wants to be walking around a park on a walking trail with someone puffing away on a cigarette right in front of them as they're out either jogging or riding their bike? So parks have developed their own smoke-free policies as well. This legislation or this amendment would have rolled all of those back and made them all null and void. This is really unfortunate, and again, would have put Ohio back decades in the tobacco control policy area. So we immediately sent out an email to our legislators through our You're the Cure work, educating them on this House Bill 513 and what this legislation includes and how far it actually goes. Again, this was at the end of the General Assembly. So Ohio's on a 2-year General Assembly cycle. That one ended, the 134th ended at the end of 2022, and the 135th General Assembly just began at the beginning of 2023. So this was during what they call lame duck session, where anything goes. Essentially, legislation can be introduced and passed within a day. Legislation can be rammed through and really kind of added into another piece of legislation that's received multiple hearings, even though that other one hadn't. So we really needed to be on our toes and make sure that we were educating the legislators that may agree with us and want to stop preemption, but also educate our volunteers on how that legislative process churns during that last 2-3 weeks of the legislative session. So this was vitally important in getting this legislation or this alert out to our volunteers to educate them so they can educate the legislature. It was through that program, through this email, we received quite a few responses asking volunteers to not only email, but also make phone calls. Typically, that is a little better response is what we find through our process. Legislators you took the time to make a phone call, they'll listen a little bit more. That's not saying that emails don't count. It's just a phone call goes a little bit farther. Next slide, please. So after that legislation passed on December 13th in the Senate Ways and Means Committee, literally in the dark of night, I think it was 9:30 at night in the winter, so it's dark at 5 o'clock. So literally at the dark of night, this legislation passed the committee after pleading with the chairman to not introduce it, to not pass this legislation, to realize what those ramifications could be. Our coalition to end tobacco targeting became a prevent preemption coalition. We really had to pivot the entire goal of that coalition. And I know during the pandemic, we use that term a lot, the pivot with workplace environments and everything else. But this was truly a 180 turn, maybe a little less than 180, but a slight turn and trying to build out this coalition and thinking of different organizations and members that would be interested in joining this fight to prevent preemption. Say that 5 times fast. So we reached out to public health organizations. As you can see the list there, it included City of Whitehall, Pelotonia, Public Health Association, State Medical Association, First Year Cleveland. We were all over the place. I don't know how many phone calls and emails every one of our coalition partners made that day seeking additional partners. And that's where the coalition work really is vitally important, because these types of organizations will have a different take and a different position and different ways to educate the legislators than what I do with the American Heart Association. So bringing their expertise in, their contacts in, their relationships within the legislature was vitally important and needed to be done as soon as humanly possible. And as you can see, all this happened between December 12th to December 14th. We had to really shift everything. We thought we were going to get off scot-free. The legislature would not know or not be paying attention to the city of Columbus, but it was a big deal. So it was all over the news. So they saw what was happening and were contacted by big tobacco lobbyists, and ultimately that amendment was drafted. So again, building your coalition, you may build it once of groups that will help you and could help you with your mission, but then you may have to readjust that or adjust that altogether once your mission changes. So we went from a enact this policy to prevent this amendment from passing, and reaching out to city officials who obviously have a stake in home rule status across the state of Ohio in protecting their communities and their city councils, and allowing them to continue to combat tobacco issues at the local level through those tobacco retail licenses. And I've mentioned that a couple of times, so let me kind of discuss that for a second. A tobacco retail license is enacted by a city council that authorizes the local health department to conduct compliance checks on your tobacco retailers. From our position, we ask that they do 2 compliance checks per year. One of those would be to ensure that the signage, the 21 and up signage, is properly placed across the retailer. The second compliance check could be an undercover agent that's going in as an 18, 19, 20-year-old attempting to purchase these products that is clearly underage. Any sort of violations of that policy would come with a fine, up to a suspension if it's within a 2-year period, if it's your 3rd violation, up to a 4th violation within a 2-year period that you could revoke. The health department and the city council would revoke your tobacco retail license, effectively putting you out of business if that's your sole source of income for that retail establishment. So that's the kind of policies that we were looking to protect by opposing this legislation or this amendment that was attached to House Bill 513. Next slide, please.
Hey, Dustin, I just want to cut in real
Yes.
quick. This is a 2-minute warning.
Excellent, thank you. So as we were going through there, obviously with the legislation that was enacted, the legislature did pass it on the House side and on the Senate side, which sent it to the governor for him to determine its fate. Once a bill is sent to the governor, he has 10 days to decide that fate. Fortunately for us, the legislature adjourned sine die, which means they ended that General Assembly on, I want to say December 29th. That legislation was obviously then sent to the governor. He didn't even get to the original issue of that legislation. He saw that it preempted this local control on tobacco policies and immediately decided to veto this legislation. So this was our alert sending to the governor to, again, educating him on the dangers of this policy and what those ramifications could be. Next slide, please. So ultimately with that veto, this is a portion of the veto message. The governor's veto message was loud and clear. He vetoed that, not necessarily because of home rule, that was a part of it, but also for the public health aspect and protecting the citizens of the state of Ohio from big tobacco and their marketing tactics. Next slide, please. And this shows where our volunteers stood out. Emails to the counselors just in that short time period, 73 in about a week time. Emails to state legislators in a 2-day period, over 1,500. Calls to the Governor DeWine, 90. Emails to Governor DeWine, again, asking him to veto this legislation, 747. And emails thanking the governor for his veto, 95. And this was all possible because of our You're the Cure networks. Next slide, please. And if you have any interest in joining our You're the Cure network, you can text 46839, the word cure to that number, and you'll receive information about what the American Heart Association is currently advocating on at the local level as well as at the State House level. And again, thank you everybody for your time. Sorry I went over.
You're doing great. Thank you, Dustin. Thank you so much. I'm glad you were able to bring a success story to us today. The work is hard and it takes a long time to do what we need to do. So next up, I'm going to bring in Angela and ask her to show herself and begin her presentation. Thank you.
Thank you, David. I appreciate it. First of all, I want to say thank you to Aaron and Dustin both for participating in this, because both of them are extraordinarily good at what they do. And Dustin deserves a big shout out because it's going to lead into my conversation. What the AHA and the work they did to get that veto on that bill was extraordinary for the short amount of time. And that only happens because there was a plan in place and it was prepared and it was structured and ready to go. And that's sort of what I'm going to talk about today, is the nuts and bolts of being advocates. So if we could go to the next slide. So touching on what Aaron and Dustin both said, your voice is necessary here. Legislators are, as the story goes, an inch thick and 5 miles wide. They're not the experts on public policy for public health or health-related issues. You guys are the experts. They have to rely on you to create good public policy. So your personal experience, you have a story to tell, and your firsthand experience working in the fields, whether you work with patients, whether you work on the groundwater testing, anything related to public health, you're the expert, the legislators. I'm not sure if you guys can hear me. Can we go to the next slide? Oh, thank you. So there's a process that goes with being a good advocate with the nuts and bolts. There's research, there's networking, there's goal setting, there's relationship building, which is what I'm going to talk about here, communication, even down to working with the media. So the one that I want to focus on today is building your network. With public health folks, and especially you with Masters of Public Health, it doesn't matter if you are working for a government entity, for a foundation in a healthcare setting, a charity, or researching, you are going to have entities that will keep you connected to others in your field. Ohio Public Health Association, Michigan Public Health Association, anything that you are engaged in or with your career, there will be a trade association that connects you to others. And keeping that line of communication open, you may be seeing an issue coming through your doors that you don't know that maybe 12 other entities are seeing the same thing, and it's going to have to be addressed through a policy issue. So by connecting to others, you can raise the profile of the issue that you are facing. You build a base of support that's organically there without having to pick up the phone and calling 250 or 300 people to gauge whether they are interested in supporting your point of view or opposing your support of you. If you have those relationships already, you have a good start on where you need to be. Maximizing resources. This is a big part of it because with public health, your bandwidth is incredibly limited for timing. How much time do you have to be an engaged advocate? Do you have time to do a letter to the editor? Or as a Master of Public Health, do you have time to help contribute to a policy brief or a position paper? Is it just a telephone call or can you do a press conference? Having a connection with others and building a network allows you to understand what how you're able to maximize your resources to engage. And it provides, finally, by connecting with others and having a working network and being part of a working network, you're able to provide third-party credibility. It's not Angela Snyder coming off the street saying, hey, I'm an expert, listen to me. It is a recognized coalition, network, organization, trade group of credibility because you work in the field, you understand the issues, and you can speak to it. So if we could go to the next slide, please. And I'm sorry I'm flying through these, but if anyone has questions, just go ahead and throw them in the chat. So the one I want to focus on today is building professional relationships. And how many people here, I think we have a poll that we could throw up here. How many people know your state legislator, your state representative, your state senator? Have you ever been to meet with your legislator or visit the state house for a meeting? You guys can go ahead and do a quick poll real quick. We'll get some answers back to you. So this is an important question because when an issue arises, you want to be prepared. You don't want to have to build these relationships from the ground up. If you have these relationships that are built and developed, they will know to pick up the phone and call you without you having to try to schedule in. And the thing about legislators, and I think the guys have talked on this, spoke on this a little bit. The state legislator has very limited time. They travel. They have hundreds of thousands of constituents with a multitude of issues. So if you have an issue and it needs to be addressed right now, well, you are fighting with dozens of other people for that same meeting time, that same phone call time, that same email review time. You are fighting for that position, and that legislator has a very limited time. So if you have a developed relationship, they're more likely to pick up the phone or return your email If you invite them to come, if you decide you work in a hospital, invite the legislator to come to your hospital and see what you do. When you're working in public health, if you work for a county department of health or city department of health, you're going to want them to come and know where you are and see your facilities, so you have that developed relationship from the get-go. And another thing, frankly, is how fast is the issue moving? If you have an issue that's moving right away, just like Dustin, you have 24 hours, less than 24 hours to do something. You can't build those relationships overnight. You want to have longstanding, in place relationships. So building relationships, that's important. Why start early? Because you need to have those ready to go. Know your key messages. This is an important part of it. And going back to the research and the homework, before you advocate for an issue, you need to do the homework first. You need to invest the time in it, because as an advocate, as Aaron reminded everyone, you need to be truthful and factual, because the legislators are relying on you. What are the pros and cons of the issue? How is it impacting you? What possible actions can be taken to make improvements or changes? Who's going to support your view? Who's going to be in there speaking with those legislators, both at the state and federal level, who might oppose your view? And frankly, more importantly, what's the cost of doing nothing? So before anyone can be a good advocate, they need to understand the issue and knowing the key messages. So if you go in, you want to go in with moving in the same direction as everyone else that you're working with. So doing the homework is incredibly valuable. So, okay, looking here, I didn't see that. I'm sorry. I was going to talk about the polls. I don't know if we can go back to that, but we can, yeah. Oh, there we go. Yes, no. Okay. So that's, no one knows your name. So we would encourage you definitely introduce yourself to your state legislators. That way they have a source to go to. It's incredibly important for them to have sources. And I saw someone say something about the legislative aid. That's absolutely correct, because I don't know if Michigan has term limits, but in Ohio, there are term limits. And oftentimes the legislative aides are the ones you are going to meet with. You're going to speak with them. You're going to communicate back and forth with them. And they are just as tuned in on the issue as what the legislator is. So definitely sometimes it's just as valuable, if not more valuable, to have the legislative aide up to speed as what it is with the legislator. So that was a great point someone brought up. So, okay, thank you. If we could go to the next slide, please. So I'm going to give a quick example of why it's important to have everything ready to go. And this is similar to Dustin's. As with the pandemic, Ohio has a group called the Ohio Advocates for Medical Freedom. And
Hey, Angela, we are not getting your audio. It looks like you're frozen.
Can you hear me now?
Yes, now we can.
Okay. So that anti-vaccine bills, all of a sudden, public health started jumping up and saying, hey, listen, this is an issue, because this doesn't just impact public policy, this impacts private policy. So as the House of Representatives started pushing this legislation, if we go to the next slide, a group of a coalition came together to educate legislators and other key policymakers about why this is an issue. And it just wasn't public health. This was the Ohio Manufacturers Association, Ohio Chamber of Commerce, retail merchants, folks who not necessarily help, but have a vested interest on having a good vaccinated population and having the ability to make their own decisions on what they would like in their entities. So there were more than 100 organizations eventually in the coalition, and they used every tool in the toolbox: social media, earned media, direct contacts such as phone calls, shoe leather at the state house, in the district, which is an important part of it. It's just policy doesn't just happen in the state house. It happens at home, at the local cafeteria, and in the grocery store, in the church. These conversations have to happen everywhere. So using the media, every tool in the toolbox was.
So while we're waiting for our technical difficulties to be corrected and hoping that Angela will call back in to finish her presentation, I just wanted to ask Aaron and Dustin a question, which really wasn't in the chat, but I think would be helpful to people. Can you two come back on for just a second? And Donnie and Rhiannon will let us know when Angela comes back. Aaron mentioned that establishing yourself as a trusted messenger is really a critical piece of the work that we're trying to do. So can you give us an example of how it is that you two have established yourselves as trusted messengers in the work that you do?
Gee, I need some time to think. Dustin, why don't you take that one first?
Say longevity and constantly, giving the truth, right? The truth will set you free. The truth will find your way into legislative meetings, and being mindful of sticking to the issue and talking about facts, and anecdotal stories will do it here and there, but I would stick specifically to the facts and creating that relationship with the legislator. It takes time, and you'll need to reach out constantly. So it's constant outreach, constant meetings, and providing the information that they're looking for.
Yeah, I'll piggyback on that. I think Dustin nailed it. Advocacy is really about, and as you mentioned, specifically about being a trusted source. It's a relationship. And I think a lot of people fail in that they fail to understand that it's a two-way relationship. As I mentioned in my presentation, you need to be willing to listen. You need to be willing to admit when you're wrong, because we're not always right 100% of the time, even though we like to think we are. So when someone points out a flaw in our logic or the way we're approaching things, or suggests a better way for public health to go about its business, I think we need to be open to hearing from policymakers, and that's how you establish a trusting relationship. It's really no different than any other relationship that you probably have in your life.
Great, thanks. That's helpful. As I think about this, the folks who are the participants, the audience in this webinar, have the longest term relationship with their legislators because they're there. They see them get elected. They see them in the office. They know what kind of legislation they've helped to introduce. So you all out there who are the audience really have the greatest opportunity to establish yourself as a trusted messenger. I think the point that both Dustin and Aaron made also is that sometimes we find ourselves not having an answer to a question that a legislator asks. Don't make it up. Go find it out and bring it back to them. Don't make it up. So a parallel question that we did have was when you
David,
begin. Yes.
Sorry to cut in, but we actually have Angela back now.
Okay.
If we want to finish up her presentation and get back to Q&A.
Please do. And I'll get back
you.
to my question later. Thank you, Aaron and Dustin.
Thank you, David. I apologize for the inconvenience. Rena, if we can go to the last slide, I'll finish up real quick because it's sort of some key things that we wanted to point out in avoiding common pitfalls that happen as an advocate. What the gentlemen were just saying with bad information, you have to have the correct and verified facts, because if not, it will come back to haunt you. An very important thing is to follow up. Always reconnecting after a meeting, a call, or email. If you promise the legislator or policymaker information, you want to get that to them, and you want to make sure they understand what you're sending. And always send thank you notes. It helps build that relationship. One thing to avoid is a disrespect. You should maintain a courteous and respectful relationship. So you may have to go in and speak with someone who you oppose to the polar opposites, what they're working on, but they have to be able to understand your position on it. And it's sometimes hard to do, but it has to be done. So you don't want them shutting down in the middle of the meeting and never calling you back. So you don't want to ask too much. You need to make your request reasonable and doable. It has to be something they can actually help with. And then disengaging. You need to stay active in the process and stay engaged with your legislative contacts. Send them newsletters, send them updates, invite them to public events that you're having, or invite them to come see your facility, or and make sure that you stay in touch with your other advocates. So So before I lose my connection again, I just want to make sure that you guys are aware that there's pitfalls that you want to avoid. So thank you so much, Rhiannon. I'll go ahead and kick it back to David.
Well, we have just a few minutes left, and I wanted to ask all three of you a question that Angela started to address, and that is, when you find yourself in a situation where you have a disagreement with the legislator, how do you handle that? If it's clear that there is a disagreement, how do you handle that in the moment?
Go ahead, Aaron.
It's uncomfortable, and no one likes to have those. We've all had those meetings. I think, part of it is kind of being able to act on an extemporaneous basis and look for points of commonality and agreement, and trying to then recircle or circle back to those points where you do have agreement. And Angela, I think, made a great point, which is the last thing you want to be is disrespectful. And sometimes that's hard because, I'll be honest with you, there are some legislators that aren't terribly respectful to people. I've seen a legislator make a sixth grader cry because they came in to lobby for, the state fossil or something. So there's some interesting personalities that you're going to encounter as you advocate. But I think it is important to be respectful, to try to find points of commonality, and then to redirect the conversation to where it is being productive as opposed to unproductive.
Yeah, agreed. And I've been called a liar to my face in meetings as I'm sharing AHA research information, and you just to use that word again, you pivot and you find other ways to keep that commonality. The question that Donnie just posted in the chat was actually kind of where I was going to go with this. Is there are many legislators that don't agree with AHA politically, that don't agree on other issues that the AHA doesn't necessarily weigh in on. However, when I'm in meeting with the legislator on, for example, right now we're working on a stroke registry bill, you put those aside. And I'm there to talk about this one specific issue. That's it. I'm not going to bring up what you tweeted about, what I read about in the newspaper. That's not important at that time. So I'm sticking to the issue, stick on message, and don't let those things deviate you away from that.
Great.
And adding to that, this is, you want to keep in mind, once you're an advocate, you're an advocate forever. And so if a legislator is not with you on this issue right now, 2 months down the line, 6 months down the line, 4 years down the line, you're going to need their help, and they're going to be with you, and they're going to stand side by side with you. So what you think of as a challenging time, you got to remember that this is just one snapshot. This is a long-term relationship that you want to build. So your enemy today is your best friend tomorrow. You want to keep that in mind.
Great. Aaron, you want to say anything to wrap up?
No, I think Angela nailed that question. Again, thank you everyone for your time and your interest. And certainly I know Dustin and Angela, I'll give them the last word as well, but we'd all be happy to follow up with you if you wanted to reach out individually. We're all happy that you're here and happy to be helpful.
Great. Thank you all so much for being here. Donnie or Rhiannon, any final thoughts?
Yeah, thanks everyone for joining. David, thank you for moderating the discussion today, and to all of our panelists, thank you so much for being here and for sharing all of your knowledge with us. And we hope to see you at one of our future sessions.
Great. Take care, everybody.